Hi, I'm Krista Lamb, and I'll be your host for a series of conversations we're calling Your Health and You, Diabetes 2. This is a short series where I will chat with Dr. Arun Garg about type 2 diabetes in the South Asian community. Dr. Garg is a medical doctor from the South Asian Health Institute and also part of the Canada-India Network Society. We're going to talk about type 2 diabetes in the South Asian community. These chats are presented by the Type 2 Diabetes Network, which is a part of the Institute for Health System Transformation and Sustainability. I look forward to sharing them with you. Welcome back to the show. We're so happy to have you back again.
Yeah, so happy to be with you and really looking forward.
Well, let's talk about this. This is a really interesting topic because I'm not as familiar with it. And so let's talk a little bit about empowerment and self-management and how these things can help with type 2 diabetes.
Absolutely, because as I've said many times when we were talking about food, any change in behavior is up to the individual. And that individual change is based on how they feel empowered. So I think from a cultural context, this is very important that the empowerment and the engagement of the individual be linked to self-realization. And that's what I talk about when we talk about empowerment of the individual for behavior modification.
And you mentioned something when we were talking earlier about the power of integrative thinking. And I hadn't heard of that, so I would love for you to explain that to me.
Yeah, so as you know, Western medicine, post-industrial, has made so much progress on science. And what happened was with that progress, we became very much reductive thinking. So everything was deeper and deeper on the individual, and in the process, even a small part of the body. So if you are thinking of diabetes, maybe you just think of insulin only. Integrative thinking is a process which makes you connect with the total body and the environment. So it's the integration of who you are in the total sense. And that concept is very culturally relevant to South Asian population because time immemorial, health has been the key component of Indian thinking or thinking of people from Indian subcontinent, which was based on what you call integrative approach to body, mind, and intellect. So mind, which is different than brain, plays a huge role how you think. So it's the thought and the thought about things. And I think as you visualize, when it comes to diet or the food or dietary habits, that becomes a key component. And the tools which like yoga is a very good example of those tools, which allows you to overcome the gap between body and mind. And that's what I mean by integrative thinking.
And for someone who is listening that might be wondering how this could apply in their life, are there examples that you can give them? Maybe doing yoga is one, but are there others that might be applicable to someone who's looking at using this in their type 2 diabetes management?
Yeah, I think they need to be comfortable. They need to be reinforcing that is up to them, especially behavior modification, dietary modification, and lifestyle modification. Very little one could do about what I call external interventions. In other words, interventions which you are doing because they are prescribed by someone else, like taking pills, taking medication. That's really very passive, and there is very little role of you in there. You have to do it. But internal interventions are very much influenced by yourself. And this is where mind plays a role. And mind really, yoga is a very good example of that tool because yoga has a prescription about stretching or asanas and has a prescription for breathing. Those two everybody knows. But great amount of emphasis on meditation, meditative thinking. So those three combined are the beautiful recipe for behavior modification of integrating body to the mind. So I would say that for South Asian context is a very important. By the way, this is applicable to all cultures, not just South Asian culture. It just happens to be that a lot of knowledge is already in that culture. The other component of integrative thinking will be social interactions. And because we are social animal, reinforcement of what is right in a group context. So a group of people coming together, talking about diabetes and then talking about those interventions really help. And once again, from a cultural context, South Asian culture is very groupy and very much depends on each other's reinforcing. And I would say that will be another example of empowerment and integrated thinking for lifestyle modification.
And is this something that you could or should be talking about with your healthcare provider or your healthcare team? Is it something that they might be able to help you with in any way?
Yeah, this is one of my real passion right now because I feel that in our healthcare system, there is a real gap. Our healthcare system is so focused on external reductive interventions that we either don't have time or capacity or knowledge to bring this for chronic disease management. And I think this is a real gap, which I call gap of chronic diseases. And definitely we can improve our system. We can improve sustainability of our healthcare system if we build some of that capacity. And this capacity could take many different forms. So you could have community clinic. You could have even an innovative ideas like YMCA, recreational places. For South Asian context, emerging area is worship places because this is where people congregate and there is large number and they're ready to listen and be affected for their health. So I see emerging areas of health committees in these congregations, and that will be another place. So unfortunately, there is a real gap about this behavior modification, lifestyle, and traditional healthcare workers. They're busy and there's so much to do on intervention, external interventions. But I think there is a gap which we must address.
And I know that in psychiatric care, mindfulness has become very much a part of their general treatment and therapy programs in a lot of the major hospitals and a lot of the major centers. Do you think that, Western medicine system, when it comes to diabetes and other chronic illnesses, could learn from what psychiatry has been doing?
Absolutely. I think in mental wellness, we have come long ways in incorporating some of those ideas. And acute care is important, and we need to continue to have reductive external interventions for that. However, the chronic diseases like diabetes, and even more important, illness prevention and health promotion, allows us to have mindfulness, meditative state. And all of that is doing is preparing your mind for integrating with body to say what is right, whether it's dietary habits, whether it's exercise, whether it's a social component, whether it's a balance, whatever it is, these are soft skills. And I think chronic care like diabetes, depression, you already talked about mental wellness, arthritis, and any of those illnesses can greatly benefit from incorporating lifestyle related integrative care in health.
And for someone who might be listening and wondering what they would see as a benefit if they incorporated some of those things into their lives, because they might not be as familiar with the benefits of these types of interventions, what would you say to them?
Yeah, so I think this is a very good question because we all want to see the results and we want to see outcomes. The biggest benefit of lifestyle is prolonging healthy component of your life. So prevention and health promotion becomes more important than disease management. The lifestyle interventions are most beneficial before disease sets in. So this is where you see the benefit. You delay the onset of diabetes, for example. In one of the earlier conversations, we talked about added sugar. If you reduce your added sugar through this intervention of mindfulness and awareness, you can delay onset of diabetes for great strength, and that's the positive outcome. Unfortunately, once the disease set up, then you do have to follow the reductive interventions of pharmaceuticals and things like this. But even there, the diet can play a major role, and some subsets of diabetes could be reversed on diet alone. So I think they could see the benefit there.
And I think whenever we're talking about this stuff, one of the things from psychiatry that we know is that some people find a great deal of balance when they have the pharmaceutical with the wellness and the mindfulness and those sorts of things as well. So those are other great things that I think some people might find helpful to know, that even if you do have to take medication at some point, doing these other things might be able to reduce your complications or help you feel even better. Would that be correct?
Yeah, absolutely. And another area where this plays out very well is in cancer care. People who have been diagnosed with cancer find it very helpful to have the support of integrative thinking, mindfulness, along with chemotherapy and pharmaceutical prescriptions, because body behaves like one. So it's not just one component or one organ, and this is where mind plays a role. So I think awareness of that goes long ways. The other thing which it also plays a positive role is it takes out any stigma associated with any illness. Now, this is one of the reasons mental wellness and mental illness has really picked up on it, because we want to destigmatize society. So in some ways we could say we are victim of our own success, because pharmaceuticals and reductive interventions played such a major role in quick fixing that becomes the go-to approach. And I think what I'm saying is we need both, and we need a balance in both, and we need the individual and individual's empowerment in self-management and self-realization. And that I think very appropriate for modern young generation, because they're so used to having self-involvement. They're very much aware of self. They want to take care of, they want to know more about it. So I think if we make this information available, then that will go a long ways. That's one of the reasons yoga is so much more popular among young, because it allows you calming of the mind, which then leads to self-awareness and self-realization and self-determination. All those are very important for empowerment and healthy living.
Yeah, so interesting and such a wonderful topic. I'm so glad that we had the chance to talk about all of this today and to learn a little something new for those of us like myself who weren't familiar with all of it. So thank you so much for joining me on the show today.
Yeah, no, pleasure is mine. And in this area, Canada India Network Society has played a major role. And we have had several conferences, and proceedings of those are available on our website in terms of integrative thinking, integrative leadership, integrative health, and integrative medicine. And I feel this is one of the future of future direction in medicine.
Wonderful. So if anyone is looking for that information, we'll make sure to include it in our show notes because I think a lot of people will want to go and check out those resources. So thank you again for joining us today. This was a wonderful chat.
Yeah, pleasure is mine. Thank you for having me.
I'm Krista Lamb, and this has been Your Health and You, Diabetes 2. For more information about this topic and many others, please visit ihsts.ca. We'd love to share more information with you. Thanks for listening.